On May 15th, United Hospital Center will be implementing EPW, Electronic Prescription Writer, for all inpatients. You will now be able to send prescriptions electronically to the patient's pharmacy of choice. Prescriptions will be sent via an electronic messaging system, EDI, or by fax. Please note you will not be able to print out prescriptions via EPW. To access EPW, you will log into Portal, select your patient, and click on the Medication Reconciliation tab.
Okay, in this portion of our video, we're going to talk about the electronic prescription writing EPW function of Orders Express. There are two ways of accessing the EPW function. We're going to talk about the initial way is most likely to be used by the physician, and it's probably the easiest way to be accessed by the physician, and then it is under the Med Reconciliation tabs. The first thing you do is touch the Reconcile Medications tab, and you can do it as part of your discharge med rec. You can actually initiate prescriptions as part of the discharge of your patient. So we'll touch the start button to initiate the discharge med rec. And you'll see this is a screen you're familiar with in doing your med rec again. Home medications as set up by the nurse on admission, and then these are the active medications the patient's on in the hospital. You see some of them are duplicates of the home medications, and again you have your home icon. These can be sorted again at the top as you're used to doing for the MedRec process. The new button here is the RX button that you can actually initiate a prescription from this screen now as part of your MedRec process. So it's not necessary to continue the meds and do the MedRec first. You can actually do it all in one step. So let's go ahead and look at each medication here and see how we can write a prescription for that medication and send it on to the pharmacy. So we'll touch the RX on the Tylenol number 3, the RX button. And we get a screen initially. This patient has an allergy to morphine, so similar to your other functions in Orders Express, you're going to have to give a justification. In this case, they're tolerating the medication as an inpatient and at home before, and we'll go on to the next screen. The first screen you're going to see lists the components of the prescription. In this case, you have the medication at the top as put in the computer system by the nurse based on the home medication that she saw the patient taking. You have down here a working description of the prescription that the patient will actually see or the pharmacy will see to type on the label for the prescription. Anything in orange has to be completed before the prescription can be released. So we're going to go do with the dose form first. One other thing at the top here, you'll notice a little page here, which if you click on the page, it will give you information on the medication. So if you have a question on dosage or side effects or allergies or anything like that, you can go to this extensive information here, very similar to a package insert. And close that screen. So it usually appears after each medication. Okay, the first thing we have is a dose form, and we'll do a drop down to get the doses of Tylenol number 3 available. You'll notice first that this could be a complication if you're not familiar with exactly how much codeine and Tylenol is in a number 3 tablet. You might have to go back to this information page to see. It is 30 milligrams of codeine, and we'll go ahead and touch that, and we'll fill in this blank with the proper dosage. So you need to watch these dosage fields that they're all going to match up with the proper medication as described up here and over here for the patient. It fills in the generic Tylenol. You have an option here of clicking on the brand name as well if you choose, and hitting the DAW, checking that box to dispense as written as the brand name product if you choose to check that box. And again, this is the working description that the patient will see here. You'll also see that you have a field here that says select a SIG template, and this is a template common for this medication. You won't see everything for the medication that you want here, but there will be common ones here. And you see you have a wide variety, but nothing actually matches 1 to 2 tablets every 6 hours as needed in this particular section. So we're going to go ahead back here, and we're going to go ahead and try to fill in these to match the SIG that you want or the description you want for the patient. So we want 1 to 2, 1-2. It's not going to take that. It will not take a dash in that field. So we're going to have to back out of that. We can complete these as we go along by mouth. Frequencies every 4 or every 6 hours in this case, which we can click on the frequency, and as a PRN medication, so we'll check PRN. So we're missing the orange section here, and we can't put 1-2 in there, 1 or 2. So we're actually going to have to free form this, and you'll see up here the SIG and you can free form this. You can do this at any time, even if it's a very simple SIG, you can free form it if you want to. So we'll touch on free form, and here's the SIG text, the free form text. And you see most of it actually is pre-filled because of the things you completed in the orange boxes. In this case, we'll just go ahead and finish this with take 1 or 2, and you have tablets. So that's all you need, 1 or 2 tablets by mouth every 6 hours as needed for pain. The for pain came from the description that the nurse gave for the home med the patient was taking already. So you actually have your completed SIG here that the pharmacy will see when you submit your information to the pharmacy. You also have the possibility to save this SIG. You saw the list of SIG templates here. If you save this on every medication that you do, you're going to have a list to see of common SIG templates that's a mile long. So I would suggest you do this only if it's something you use very, very frequently, and you would use, it's very unusual SIG. So I would use this with great discretion of adding SIGs to the template. Okay, you also are limited to 187 characters here. One other point about this SIG template box here in the drop-down, this will only appear on patients ages 18 to 65, and that is because the parameter is set that way so that younger patients and older patients, they feel you need to take special care with their instructions. So this will be grayed out. You won't have access to this button or this field in patients under 18 or over 65. Okay, the last thing on this particular section requires a reason for the prescription medication. Now this is a reason that really goes to authorizations and insurance information. So if we click on this add or edit a reason, you'll see in this particular patient has a problem of influenza virus, and this has nothing to do with their pain medication, so this really doesn't fit. If it did, you could highlight that, hit add, and add it to the reasons down here. You can look at indications if you'd like and see if something up here fits what you want. And if you want to do that, you could add it and bring it down. Or you can search, which is what you're going to do probably often. In this case, it just has for pain. If you put in pain, you get a very long list. Usually touch contains here, so it contains the word pain. You get a very long list of items, and it takes a while to get that list up. So if you want to put in leg pain or something more specific, you'll get a much shorter list. In this case, we put pain, and you see what kind of information we got for pain. And again, these are ICD-9 codes or codes that you can actually use. Here's a pain in the limb, pain to the thoracic spine. I think there's one that's general pain. Generalized pain, we'll go ahead and pick that one, say OK. And it's added down here to the reasons for the prescription. We'll touch OK, and it'll come back to this field for us. And that will go to the pharmacy as a indication for the medication. It doesn't change the information to the patient on their prescription. The last section is a dispense quantity and dispense information. You'll notice it's asking for a sufficient quantity, a certain number of days or weeks and months. So if you need a 3-month supply, you can change this to months and put 3 in this field. In this case, we're going to go with, say, a 10-day supply of the Tylenol. The one thing that is not highlighted is the quantity area. We are told that the quantity is necessary to get the prescription sent to the pharmacy. So you must fill in the quantity area. If this information is recognized up here in this section, it will calculate that. In this case, it's not recognized, so you have to calculate the quantity yourself. And on this particular medication, you may not want to give 4 tablets per day. You may want the patient only to take 2 a day. So we'll go ahead and do 20 tablets for a 10-day supply. Refills are over to the right side. Go ahead and give them 5 refills on this. And so this area is completed. Now you will notice on the right side here, you have some other areas like total doses per day. In this case, we're going to suggest the patient only take 2 doses per day of 1 tablet each. So we're going to hold that down, the number of doses per day. This will automatically fill in if we will see in the future scripts if it recognizes the frequency. You can also put a message to the pharmacy and say, do not fill early. So you don't want the patient getting these early. Okay, so you have all these filled in. We also have areas for eligibility and history, and we'll go over those a little later for you. And this will tell you some things as well about whether this is on the insurance company's formulary and what the patient is eligible for on their formulary with the insurance, and you can make some adjustments. And we'll talk about that a little later in the the video. Okay, we're finished with this prescription. We're going to save this prescription, and it's going to ask you if you're continuing it for MedRec or modifying it for MedRec. We're just continuing it. We'll leave it on continue. You see both are checked now. The MedRec continue plus the RX is checked. And we also have the little RX symbol here that says an RX will be generated for it. And hover over that, and that shows you the allergy that you overrode and the reasons. Now, if you change your mind after you've done this, you can remove the RX, and it will take the RX off of here, and it will just be continued for home use if you discover the patient already has a bottle at home. Okay, we have here flaxseed oil, and that was not continued if you notice down here, so we can still continue it. Even though it was stopped during the hospital, we can continue it here. This is over the counter, so we don't need a prescription, so we're just going to continue that at home. It'll show up in the patient's home med list. Again, you want to try to work with these first because this is a cleaner view on the patient's home med list when they're discharged. If you continue all of these here and stop all these here, it will tell the patient to discontinue and stop taking the Tylenol number 3, and then it'll tell them again later in the med list to start taking Tylenol number 3. So it can be confusing if you decide to do it that way. Okay, let's go ahead and continue the Advair inhaler and do an RX for that. And again, you come up with the nurse's description, and there's actually no strength up here, so you may be a little bit of a loss to what strength to choose in this blank, but you will notice that they were on it in the hospital, the 250 per 50. So you have the information you need to continue it. And again, you see some more things highlighted here. If we pull the drop down here, it's a rather cumbersome description in this drop down. We could accept that if we want. We'll accept that drop down, and you see it pre-populates some of these areas and puts that rather cumbersome description there. And the rest of the information here about morning and evening, approximately 12 hours apart, is listed here in special instructions, but everything is listed here that you need. So if we don't like this, we can actually backspace some of this out. If we don't think they need to take it 12 hours apart necessarily, we can backspace. The delete key does not work in this field. Just the backspace will work in this field. We do not require a reason here unless you want to put one for insurance purposes. It's required only on PRN medications, and this isn't PRN. You'll notice it filled in the total doses per day from the BID frequency. And once we come down here to the dispense amount, say we want to give them a 3-month supply, change this to 3 months, it will calculate the quantity here of 180. So you already have your quantity calculated for the 3 months or 90 days at twice a day. And we'll go ahead and decide on a refill here. We'll go ahead and give them the rest, not a year's refills, would be only 3 more. So we'll give them a full year of the medication. And we'll save that. We're all finished with that one. And it's a continue. Okay, let's go to the Hyzar. Now you'll notice that the Hyzar is a combination med, and in the hospital you had the 2 separate meds here listed. So we can still continue that as it was prior to admission. And in this case, we have the description up here. We can choose the correct 10 to 25. And let's go ahead and fit this one in. 1 tablet by mouth, a frequency of daily. And we'll have this one all finished up for you. Again, 1 per dose per day. And we'll do a 30-day supply on this one, 30 days of 30 tablets, no refills for this reason. Okay, so we'll save that. Now, one thing you can notice here at the bottom, I forgot to mention so far, is you can find a different med. So if you get in here and you're thinking about this and their blood pressure hasn't been controlled and you think, well, we need to change this to something else, you can actually find a different med and get a different medication here by clicking on this, and it brings up a blank screen, which we'll look at here in a short while, the blank screen. And if you do that here, you'll get that blank screen. We'll show it to you a little later. Okay, we can save this. Again, it's a continue. Okay, we have Phenergan with codeine. We'll go ahead and do a prescription for that. They're taking it for cough. And again, we're going to get an allergy with the morphine. It's not a true allergy with this patient, so we'll go to the next one. And you see this is pretty much filled in. The nurse put more information in on this drug when she put it in the home meds for the patient. So you have a dose or a strength of the medications already pre-filled for you. And everything's filled down here. The only thing missing is the route. If you change that to by mouth, you have it set up. You have to watch exactly what's in here, however. You'll notice that the prescription was for 2 teaspoons previously when they came in. It's stated here in mLs, so you end up with a dose of 2 mLs, and that's what the patient's going to see or the pharmacy will see when the script goes to the pharmacy. So you need to keep an eye on this. The options here, again, are mLs or mLs. You don't have a teaspoon option here. So there's a couple things you can do. Change this to 10, And most likely the pharmacy will change that to 2 teaspoons or 10 ml so the patient will understand how to take it when the pharmacy does the prescription. The other thing is you could actually free form this, go back to free form and change it here to 2 teaspoons if you felt that that's a better thing to do. So we can take this out, the 10 ml, and take 2 teaspoons, or you could spell it out if you want, by mouth every 4 hours as needed. And the want for cough in there as well, because the nurse actually put that in as an indication, so it came down here and populated your reason. So we have this set up here as well. So there's 2 ways of doing it. We can take the free form out and it'll go back to our 10 ml, and we'll just show you how that looks in the long run. So you don't have to add a PRN reason here because the nurse actually put an indication in early on for cough. Okay. The dispensed dose, we'll go ahead and touch down here, sufficient quantity, and we want to go ahead and give them, say, a 10-day supply, and they're on this chronically, so we'll give them some refills on this chronic medication. We'll give them 5 refills. You'll notice it's going to pre-populate this based on the fact that it thinks it's going to take it every 4 hours as needed, 6 times a day, 60 mLs a day, 600 mLs for 10 days. So you want to go ahead and change the quantity unless you want them to get a huge bottle. We could go in mLs to, say, 200 mLs instead. Okay, we'll go ahead and save this. We're ready to go with that one. Triamcinolone cream, go ahead and do an RX for that. If they say they have their own RX for that, you can just hit continue if they don't need anything further. Okay, we'll go ahead and do an RX for the triamcinolone. Get through this one quickly. Again, it's filled in pretty thoroughly. And we could do the drop down here, and it's apply a thin layer 2 times a day. So this does kind of equal this. Apply a thin layer to the affected areas by topical route 2 times a day. So that looks pretty good, but it's kind of an odd thing for the patient to see. So we can adjust that here. Don't really need by a topical route. We can go ahead and take that out by backspacing that particular piece in, and thin layer to affected areas, and we can put for rash here if we want to put what we need. So we can make this what we want by starting out with the template and then doing a free form and adjusting what's in there. Okay, and there's no reason for this. And we'll go ahead and they're chronically on this 30-day supply. Now you see, a little bit of a quandary here. You want a quantity amount and you want a rather large tube, but you may not know off the top of your head what size tube you have. There is a pre-package field that comes up on some items, usually ointments and things like that, that tells you the size of tube that's commonly available. And in this case, you want a rather large tube, so we'll go with 45-gram tube here, which is a little larger than normal, and we'll go ahead and change this to 45. You have to free form it, 45 grams, okay? And we'll do some refills here to get them through the year. Okay, so this is how you would do this particular item, give them a 30-day supply, and look up your amount here if you didn't know what the amount was. And we'll go ahead and save this one. Okay, so we've almost finished. We'll do one last one, the amio. Well, let's stop the Ambien. We'll just say we don't want to give that. It's home. They're not having any problems sleeping. We'll hold off on that for a short while. One thing you can do here as well is you can continue a medication that's been given in the hospital. If they want to continue that at home, the aspirin is over the counter, so you just need to continue that. You really don't need to put in a prescription for it. Just continue it here, and you'll see it comes over to your working list, and it's just continued. There's no RX button or anything here. It's not been given. If we want to continue the DocuState, let's say we want to do an RX on that, so the patient is sure to take it. We think if they get it over the counter, they may not take it, so we'll go ahead and do an RX for that. It's filled in here. The dose will do 1. Well, hopefully do 1. Okay, let's go back here. 1 capsule. There we go. 1 capsule by mouth. And we'll pick the 2 times a day frequency. And so we finish this area here. Just give them a few days supply, like a 10-day supply. And it calculates your 20 capsules here. No refills particularly on that one. And we'll save that. Okay. If you notice, this patient is on an IV antibiotic. They're on Avalox IV, and so you want to continue that orally. Say you want to continue that at home orally, you can add a new med here for an RX for new med. You can also just simply add an OTC med just to continue it here by adding a home med, say. So you can add an OTC med like the aspirin. But if you want to add another RX that's different from these, you can add it here by saying RX for med. And this is the same screen you will see when we add a different med from that tab I mentioned earlier. So you can touch here and search for the medication. We want Avelox. If you touch in this section and search for Avelox, in this case you get some variety of options here, and I usually would just take the Avelox oral and fill in the doses and everything as you have. So click on the Avelox oral, brings up similar screen to what you're used to seeing already, and we'll do 1 tablet by mouth daily. Okay, and you only want to finish out maybe a 10-day course with another 6 days of oral medication. It's going to fill in the quantity here for you. Again, you need to make sure this is filled in before you finish your prescription. Okay, and that's all you need on this, so we can save that. We'll have our prescription for an antibiotic added. Okay, once you're finished with all the medications you want for the patient, there are RXs, and all these are addressed for the discharge med rec. You can go down to complete the med rec and touch here to complete the med rec. And you'll notice it's going to review the overrides you've done. We'll hit next there. And it's going to also override, you see the overrides one more time, plus you're going to have 3 options here to finish your med rec. One is to complete the med rec only, and it will not get you to the prescription writer at all, or you can complete the med rec and take yourself to the prescription writer by checking this one. Not complete, you can back out. You can cancel your session. So in this case, we're going to complete it and go to the prescription writer. We'll hit OK, and it will complete our med rec and finish that for us and take us to the prescription writer to initiate submitting prescriptions to the pharmacy. Okay. So the first screen you'll see is one to select your pharmacy that you want to send the prescriptions to. You notice your prescriptions have come up here as pending because you haven't actually submitted them to the pharmacy. One very, very important thing you need to do is watch this area up here and see if there are already prescriptions there. A consultant or another physician that's working on the patient may have come in their specialty and added an antibiotic or a cardiac med or something of that nature previous to you doing your discharge med rec, and they may already have prescriptions up here that they have submitted. So you need to be very careful. The system will not tell you that there are duplicates there. It will not tell you that. You have to watch this area yourself. Okay, so let's go ahead and search for a pharmacy by touching here. Now you can specify some things here, but usually the easiest, since we're usually dealing with local pharmacies, you can put in, for instance, our pharmacy here is United, but let's try a local one downtown. Let's try Bayard Pharmacy downtown, and you know it's in West Virginia, so the minimum you can put in, the better. We'll go ahead and put Bayard's in West Virginia, and we can select Bayard's, and this is the one we can select by highlighting that. If you want our local pharmacy here in the building, you can put United in. And if you know our zip code, 26330, and search, and it brings United Pharmacy up. So usually zip or city with the first brief name of the pharmacy will get you what you want. Highlight this and hit OK, and it will select the pharmacy for you. These pharmacies are built with their fax numbers and EDI locations so that they can send the medication out without problems to the pharmacy. Now this is not in the training environment, not let me choose EDI. In live, you'll be able to choose EDI or fax for these. Again, prescriptions for scheduled medication, you'll still have to handwrite because those will not be transmitted, Schedule 2 medications, but we can transmit the other medications here. So in this case, you will see the EDI come up to check, but in training, it's not working for us. Okay, in this case, it's going to be faxed. If you review your medications here, and they're what you want, we can go ahead, and if it's not what you want, you can put no action as well, and send the prescription won't be sent. So once you have everything the way you want it, you hit submit, and this will not submit because I'm in train, but it's going to take a few minutes here to try to submit it. In live, it actually submits it through a company called SureScripts, where it does some adjudication of the prescriptions and sends them on to the pharmacy. If they're faxed, they are faxed directly to the pharmacy if it's a fax. Downtime, if SureScripts is not working properly, it automatically faxes instead of going through SureScripts. Okay, this will take a couple minutes and then we'll finish this session up. We will have additional information about looking at some of the other aspects like eligibility and things here after I finish with my portion of this. Okay, it's taking much longer than I'm used to. We need to show you one other thing, one other way of accessing prescriptions. If you would be a consultant or would be wanting to go in and do prescriptions before you do MedRec, and I would suggest you only do that if you're not the attending. If you are the attending, I suggest you do it through the discharge MedRec process. It's much simpler. There is one other way of doing this, and we'll go back and pick a different patient. And again, once your prescriptions have been submitted, they will go from pending to submitted, and you'll be able to see those at the top. Okay, let's go back and I'll show you one other way of getting into your prescriptions, the prescription writer, and we'll look at a different patient here. Okay, we'll bring up this patient here. And you can get into it from the med reconciliation screen again. Go to med reconciliation, touch reconcile meds, and touch the discharge button here on the left, the discharge button first, and you'll see you get a new window here, a new button to prescribe medications. We'll touch this and it'll bring up a screen that you noticed before. Now there is a couple things that you can do here on new medications. It's going to ask you the pharmacy, but this is really out of order, so we'll cancel this to start with. We'll select the pharmacy later. In this case, you'll notice you have several things here. Let's put a new med in to start with, and I'll show you a couple extra items here. So this is the way you can add new meds. You don't see your home meds here at all. You're just adding a brand new med. Let's go ahead and add low pressure. Type in low pressure and search, hit enter to search, and you have IV and you have HCT. Now you didn't get plain low pressure because the low pressure brand name is not available any longer, so it didn't give you that under low pressure. If we want metoprolol, I have to put it in with a generic name. Touch enter, and you get the succinate and the tartrate IV and oral. So we'll go ahead and pick the tartrate oral. Get a similar screen you've seen before. We'll pick 25 milligrams, and we'll pick, now this patient, okay, you show you the templates here. We'll just do one tablet 2 times a day, fills in everything for us, and we'll do a 30-day supply here. Now you notice one thing on this screen that we did not see when we were doing the MedRec with the RX function. You'll see that you have saved the RX to your short list. And you'll see back here in the background, this is a short list. Well, here it has short lists listed to the left, and we'll look at those in a second. But you can develop a short list of medications if you commonly do the same medication on every patient or frequently use that. We have been cautioned by the company, the computer company, not to overuse this because it will slow down the user. If you have a lot of things in your short list and things that you don't use very often, it will slow you down in your function. So if you're a surgeon, you use post-op meds on a lot of your patients that are identical, you might want to do your own template, own short list of templates. So you can click on this and we'll add it to the template, and I'll show you a couple that are on this particular doctor's short list here in a second. So let's go ahead and save this metoprolol that we've done, and you see it comes up here to pending prescriptions. Now we'll go ahead and look at a couple things here. We can look at the home med list of the patient, and we look at the patient your short list, and it says my medication short list, and you see there's a couple things here that are on the physician's short list that we'll go ahead and pull this Vistaril up, and you still have to fill in your doses and everything on here, but it's going to give you items that you normally have, and you can pre-build these so that they are pretty consistent with what you want for your usage. It's 4 times a day, and we'll finish this up 5-day supply. Okay, and it will be more specific for what you're wanting on your short list. And we could pick, if we wanted to pick this one, it's going to be complete. We picked just the drug. If we want to pick this one down at the bottom here, it would be complete, and it's going to actually come up there right away. As you see, I did it twice accidentally. Come up there with everything filled in, refills, the number of capsules. It fills in the whole prescription if you check on one of these. It adds all the elements of the prescription. I don't want all those. Now there is an X here that you can take that out if you don't want it. And we want to delete that one script because I did duplicate it, okay? So if you touch this one, it gives you the base drug. If you touch this one, it gives you the whole SIG as you've built it in your template. So use those discretion at your discretion, but minimally, so that you have them and it keeps your speed. There are short lists that we can build as a hospital. Pharmacy can build those. IT can build those for you. We would ask you to send a request to us, and we can build a short list for you. And again, we'll have to keep those to a minimum as well. Okay. So this is a way you can add medications without going through the discharge med rec process. And I would use this again if I was a consultant or working on a patient I was not at the attending, would not be doing the discharge med rec. And again, these can be submitted. There is a submit key. It's a little different than before. It's usually down here. It's up at the upper right corner here to submit them. And again, you have to search for your pharmacy. Do Bayard Pharmacy in West Virginia. Search for that. Highlight that and hit OK. And it has Bayard's here for you. And again, EDI is not open, but we can do it that way. We'll submit those. And it's going to run and ask us to wait until those are submitted for this particular patient to Bayard's. Okay, so we'll go over some of the information on eligibility in a second, and this is basically how you write prescriptions in these two ways.
Due to limitations within the training system, we were unable to demonstrate for you a patient with eligible insurance, so we are going to discuss that very briefly here. When prescribing a medication for a patient, you will come up on the patient banner at the top, and inside that you will see the words eligibility, and it will list the different insurance companies that the patient may have. By clicking on that, you will receive any demographic information on the patient that the system has, as well as the different insurance providers for the patient. Also, underneath this coverage information, you will be able to see the different copays that the patient may have for a particular medication. And this will allow you to make more informed decisions regarding the medications that you prescribe for your patient. Finally, we have a list of important reminders that we have for you. The first is that prescriptions can only be sent via EDI electronically or by fax. You will not be able to print prescriptions. For Schedule II medications, you will need to continue to write your prescriptions on a prescription pad. When choosing the method of delivery for the prescription, if the EDI button is grayed out, then the receiving pharmacy does not accept electronic prescriptions, only fax scripts. When prescribing a medication, you must fill out the quantity sufficient for section, as well as highlight and complete the quantity section right below. While short lists are convenient, please keep medications to a minimum. Excessive amounts of medications could slow down the process. If at any time you would like to make a short list for your practice group, please contact the pharmacy at 1560 to set this up. Upon completion of this video, please contact Patsy at extension 1030 to obtain EPW access via the portal.